Right.
community member, two of my favorite members in the House, really. Uh, and it's an honor and a privilege to testify before you. I I actually submitted the 10 community project funding requests, but this was my priority, my top priority. And I'm requesting $2 million in funding for the community health centers of Pinellas County in Florida, in the Tampa Bay area, to expand on the mental health, behavioral, and substance use disorder services in Pinellas and Pasco counties, again in Central Florida, West Central Florida. Our community, much like many across the state and nation, have seen a tremendous spike in mental health related tragedies over the past year. This includes overdose deaths, unfortunately, suicides, incidents of domestic violence, and elderly and child abuse cases. Unfortunately, the pre pandemic rates for these societal problems were already among some of the highest in our state and nation, Pasco and Pinellas counties. The pandemic just exacerbated the problem. Despite increases in federal funding in recent years, Florida remains among the nation's lowest in per person funding for mental health services and substance abuse treatment. And I know that there are folks that come to Florida specifically more because of the weather, but they have relatives living there to get this type of treatment. Many who are seeking help still can't access quality treatment, and that needs to change. Community health centers have proven to be an effective model for delivering high quality health care. I know you know that, including mental health and substance abuse services to those who are insured, underinsured, and uninsured. However, they simply do not have the funding to meet the dramatic rise in need for these services within our community. I have always been a strong proponent of community health centers because of the remarkable track record of success. I believe they are part of what is right in our healthcare system, and I know that's a bipartisan view. They offer an integrated medical home approach to healthcare that leads to successful patient outcomes and cost savings. As a trusted existing partner in our community, and that's why I chose them, I believe they are the appropriate entity to help fill the incredible gap in our community that exists as a result of the pandemic. With this funding, the community health centers of Pinellas County will expand their outreach to people during their toughest times by establishing two new facilities targeting mental health and substance use disorder services in the Tampa Bay area of Florida. This would include one facility in Pinellas County and one facility in Pasco County. Now, the Pinellas County facility has yet to be decided. It may not even be in my district, but again, I don't care. I want to help these people. The proposal has the support of the Pasco County Commissioners as well as the uh, Florida House Representative Chris Lavella and Florida State Senator Darrell Rouson, who represents the area. Lastly, I want to acknowledge the amazing work that the community health centers does and what they've been able to do during the pandemic. They've been a godsend. The organization opened one of the first multiple testing sites for COVID in both Pinellas and Pasco counties. The community health centers provided primary care services to over 76,000 patients, including 40,000 COVID tests and administering over 20,000 vaccines and counting. It is this track record of success and community trust, along with their accreditations by the Accreditation Association of the Ambulatory Healthcare and the National Committee for Quality Assurance, that makes them deserving as a Community Project Fund recipient. Their history certainly proves that they will be a good steward of funds as they expand to address the mental, behavioral, and substance use disorder needs of our community. And again, Madam Chair, I've been working with the community health centers for years, and I approached them about this issue, and they said yes, we would love to expand our outreach, and I know how you know how vital this issue is, how important it is to all of America. So thank you very much for for giving me the opportunity. And again, that is my top priority. I know this is HHS, but it's my overall top priority as far as earmarks are concerned. Thank you. And I know we're not supposed to use that word, but this is a great one.
And I hear you. I hear you. We both hear you. And thank you so much. Thank you for coming